Hello everybody, welcome to the Tuesday edition of Video Clips. And first of all, just a couple of announcements. On Tuesday, December 3rd, that's next week, I can't believe it's already December, Chef Del is going to do his last Conversations with Chef Del for the year. He'll be talking about healthy desserts for the holidays. You don't have to give those up. You can eat something that's actually quite delicious and not quite so toxic. And then he'll take your questions about diet and food and cooking and that sort of thing. And the other thing is we do have the schedule for winter semester for the Wellness Forum Institute. So if you're planning to take some classes or you just want to inquire and find out a little bit more about it, you can send me an email or call our office, pampopper@msn.com or 614-841-7700. We're offering some really great classes, a couple for the first time. One is Healthy Institutional Food Management, and the other is meal plans for all kinds of medical conditions ranging from diabetes to kidney failure. So anyway, you can get more information from us. All right, today I want to talk about this new announcement. It's a couple weeks old now. It's not actually really new. About statin drugs, and I'll tell you what I think about it. A lot of people are horrified. Some people think it's great. As usual, what I try to do is dissect the information and report it to you, and then give you good information to make decisions about. But this is my take on it. The American Heart Association and the American College of Cardiology were involved in developing these new guidelines as to who should take statin drugs. And basically, no matter how you look at this, more people are going to end up taking statins if they follow these new guidelines. Now, 25% of people over the age of 40 are already taking statin drugs, and millions more are going to. And one other thing, and this is sort of a blessing and curse, and I'll explain it in a second. Patients will no longer be given target levels for lowering their cholesterol, their LDL cholesterol in particular. I guess now we just take the statins and assume that that's enough. Now, first of all, the guidelines define two major categories that should qualify for medication. One group is people who have diabetes or who have had a heart attack. The other is people who have LDL levels of 190 or higher. My gosh, does that sound high to me? Previously, now people in these categories would have been advised to aim for LDL really low, at 70 or lower, but this is no longer a requirement. Now, everybody who doesn't fit into those two categories should take a statin if the risk for heart attack or stroke in the next 10 years is 7.5% or higher. And doctors are instructed to use this online calculator for risk that considers things like cholesterol, blood pressure, age, and that sort of thing. Well, problems have already developed with the online calculator, with some cardiologists saying it will unnecessarily lead to the medicating of millions and millions and millions of people. Apparently the same folks that were involved in the health.gov website must have been participating in this risk calculator. Now this is a stunning admission from a group that tends to be a little prescription happy most of the time, in my opinion. In response to problems with the calculator, an emergency meeting was scheduled at the annual American Heart Association's conference, and the report that followed from the organizations that developed the guidelines stated that patients and doctors should discuss treatment options rather than just using the calculator. Now, there are so many problems with the way guidelines are developed, and this is just one more example. According to articles covering this topic, the problem with the risk calculator was actually discovered over a year ago by two Harvard University medical school professors who were asked to review a draft of the guidelines. They reported that the calculator didn't work and that it overestimated risk by between 75 and 150%, depending on the population. But apparently, the researchers who were developing the guidelines were never given this feedback, so they just didn't take it into consideration. Now, we don't know everything about this process, but what it does appear is that the guidelines were developed in somewhat of a vacuum. Now, there is a tiny bit of good news in the midst of this disaster. While I disagree with the idea that patients shouldn't pay attention to their cholesterol levels, I think people should pay attention to their biomarkers. At least there's some recognition that the aggressive use of statin drugs to lower cholesterol has not benefited patients. The guidelines acknowledge that previous emphasis on lowering cholesterol to specific levels often resulted in more drugs being prescribed, and also you probably have seen advertisements for these combination drugs like Vytorin that have two cholesterol-lowering drugs in them in an attempt to just medicate the heck out of people and get their LDL levels down to 70. Well, the use of additional medications, according to this report, has not been shown to prevent heart attacks or strokes. So, if we're trying to find something good to talk about here. Now, some experts claim that the advice about statins will help patients. Others are critical, saying that the guidelines ignore studies showing that people who have genes that predispose them to low LDL cholesterol have fewer heart attacks and strokes. But these experts use this fact to justify more medication, ignoring the fact that many people with low LDL cholesterol, because of their diet, also have low risk of stroke and heart attack. So instead of recommending aggressive statin therapy, how about some aggressive dietary therapy, a low-fat, plant-based diet? The evidence is much stronger. To their credit, again, finding a tiny little bit of silver lining here, the committee members have said that lowering cholesterol with drugs may not have the same effect as lowering cholesterol with diet. Well, it not only doesn't have the same effect, it's nowhere near. I mean, taking Crestor reduces your risk of a heart attack or major coronary event by 1.2%, while dietary therapy has a considerably better track record. Now, other critics think that the whole idea of the 10-year risk assessment is faulty. They claim that younger people have lower risk due to their age, but could benefit from taking statins for several decades to make sure their cholesterol stays low. And that just astounds me, using statin drugs as a prophylactic in young, healthy people. I mean, the next thing they'll be putting it in the water. And by the way, that idea actually has been floated on some medical sites before. So, lest you think I'm crazy, this has actually been discussed. So the drug companies have successfully trained some zealots who are very enthusiastic about drugs and look at every opportunity to come up with ideas to drug people more. Now, there are a few voices of reason speaking out about the fact that people who should not be medicated will be under the new guidelines. Dr. Paul Ridker, the director of the Center for Cardiovascular Disease and Prevention at Brigham and Women's Hospital in Boston, gosh, was that a mouthful, used the example of an older man who smokes with low LDL and moderately elevated blood pressure. This guy would qualify for statins according to the online calculator, but Dr. Ridker says this person really needs to stop smoking and lower his blood pressure, not take statins. Gosh, if only more people would come that direction. What this will mean in terms of practice, actually really hard to say. Honestly, most of the time, new recommendations do not get translated into new practices, regardless of what the evidence says. But it's disheartening to see these groups just continue to tout the benefits of drugs, like statin drugs, for addressing risk factors for coronary artery disease instead of dietary intervention. It's really good for the drug companies. Boy, are these folks good at drumming up business for them, but it is really bad for the public. Well, that's all for now, and actually for this week. We're not going to have video clips on Thursday because it is Thanksgiving. So I'll leave you with this thought for Thanksgiving. I won't be talking to you on Thanksgiving morning like I usually do on Thursday morning, but I want you to plan to have a very healthy and health-promoting Thanksgiving and Thanksgiving dinner with your family and friends, and don't eat anything I wouldn't eat. And while you're grazing at the table, just hear the voice in the back of my head telling you that you might enjoy this a little bit right now, but tomorrow you probably won't feel so good physically or maybe so good about eating it. So for my own Thanksgiving, I'll be having baked stuffed squash from the Wellness Farm Kitchen and vegan sweet potato pie and big salads, and it will be a fabulous feast. It just won't contain animal food and it won't contain fat and a lot of garbage, and I will feel great on Friday morning. So that's what I wish for you for Thanksgiving. All right, so have a great, healthy, happy holiday, and I will talk to you again next Tuesday.